Good day, I am CPC-Comonal from BSN1 11K. And now, or today, I am going to demonstrate the assessment of the abdomen. Pre-introductory phase. Of course, here I'm going to perform the pre-introductory steps, which is the first thing to do is to review the previous medical record of the client and the doctor sheet if available. Okay, reviewing now the medical record of my assigned client. Okay, we are doing this, or I am doing this because this is actually for me in order for me to know the medical history, so the health background of this client, because the things that I actually see here is about my client's previous health problems. So I'll be able to know the things that I have to consider in performing this assessment. And in doing this also provides the focus and the appropriate assessment that I'll be doing to this patient. And now that I have reviewed the medical record, so next thing to do is to determine the scope of the assessment needed and to prepare the necessary equipment. Okay, determining the scope of the assessment now, because this is actually done for me to be able to know the extent of the assessment that I will be doing to the patient. Okay, so in my patient's case, I'll be just focusing, assessing for his abdomen and using the IAPP, which is to inspect, then auscultate, then percuss, then palpate. So we're going to look first, then listen, then percuss, then palpate. Because the reason for that, actually, we don't want to agitate or palpate or move around the abdominal cavity, okay? Because here in the assessment of the abdomen, we want to hear or to listen first to listen for the truest bowel sounds of the patient. Okay, now that they have determined the scope, and now, or in this, by this time, here in the pre-introductory phase, is to prepare the necessary equipment, because this is for me to save time and energy. Okay, so of course I have here the stethoscope, and the clean working gloves. I also have a alcohol here, the gown, okay, and the measuring tape and the inch ruler. Okay, so now that I have prepared the needed equipment, so now I'm good to go to the next step, which is to perform the hand washing, and afterwards is to don gloves if deemed necessary. Okay, now that I have washed my hands properly and thoroughly, so now I'm actually good to go to meet and greet my patient. Of course, performing the introductory steps, which is I greet and introduce myself to the client and to his or her companions if around. Of course, that is to build rapport and gain the trust and respect of the client and to the people that she or he is with. And to verify the client's identity, because verifying the client's identity ensures that the care or that the procedure or the assessment, the right assessment is rendered to the right or to the correct client. And I also have to actually ask the patient how he or she would like to be called during the assessment, because that actually shows to the patient that we are, or I am considerate to the things that she has to say. Then I'm going to explain the procedure and how he or she can participate during the assessment, because explaining the procedure actually reduces the anxiety of the client and encourage the participation and the cooperation of the client. Okay, now I am good to go to head to my patient.
Come in.
Okay, good day, sir.
Good day.
Okay, sir, I am CPC-Comonal, your student nurse for today. I am actually a first-year nursing student from Davao Doctors College. Okay, sir, may I see your wristband, please? Okay, thank you very much. Okay, please state your complete name.
Roberto Zaragoza Comunal,
Okay, and your birthday?
August 23, 1966.
Okay, thank you very much, Mr. Comonal. How would you like me to address you?
Just call me Bart.
Okay, Bert, are you Bisaya?
Yes.
Okay, because Bisaya would go, so do you want me to speak in Bisaya or in a different dialect?
Just speak in English.
Okay, so I have your permission that I'll be continuing to speak with you in English. Okay, Bert, so today I am going to assess your abdomen. So I'm going to check the condition, okay, in this portion of your body, okay, your belly area, your abdomen. Okay, and in order for me to properly examine or to assess your abdomen, Bert, so I'm actually going to have to ask you later to remove your clothing or your shirt only. Because we're going to have to actually expose the area, your belly area. But don't you worry, Bert, I'll be providing a gown for you to change into if you would like. And don't you worry, because we're going to expose only the area that we're going to assess, which is this portion, okay? And Bert, there will be part of the assessment that I'll be needing you to lie down in bed, and there will be also a part that you'll need to stand. And Bert, actually going to put a mark on your abdomen, on the skin of your abdomen. So would that be okay with you?
Okay.
Okay, thank you very much. Okay, Bert, is there anything that you would like to ask, clarify, or any concerns, especially regarding with the procedure that I have just explained?
None.
Okay, so Bert, during the assessment, okay, don't hesitate to ask if you have questions or concerns, especially if there are part of the assessment that is uncomfortable with you. So just let me know, okay? Just tell me right away, okay?
Okay.
Okay, thank you very much. Okay, next thing to do is to ensure the client's comfort, privacy, and confidentiality. Of course, by making sure that the doors are closed and the curtains are draped or down. Okay, Bert, just wait a second. I'll just make sure that the doors are closed, okay, for your privacy and for you or for us to be free from any distractions. Okay, the doors are closed and the curtains are draped. Okay, I think we're good here. And Bert, regarding with the information that I will be acquiring here, don't you worry. I assure you that all the information, the confidential information that I will be acquiring here will remain confidential between me and the attending physician that I will be referring to. Okay, so don't you worry about that. Okay, and next thing to do, now that I have ensured my patient's privacy, so now I'm going to ensure that the client has emptied his bladder. Okay, Bert, I also would like to ask, have you already void or peed this morning or before I got into here?
Yes.
Okay.
Yes, I have.
Okay, so that's great to hear. Okay, because I am actually, or we're actually asking for that or ensuring that our clients has already emptied their bladder, because actually the fullness or if our client has a full bladder, then that could actually influence the findings and of course for the patient's comfort, because in the assessment of the abdomen, we're going to actually palpate, percuss, or going to apply pressure on her abdomen area that also covers also which the bladder is in. So that actually can cause the client to void if palpated, or the client will be in pain. Okay, so now that I have confirmed that he already emptied his bladder, so actually now I'm going to ask the patient to remove his shirt. Okay, Bert, can you remove your shirt for me now? Okay, thank you very much, Bert. So Bert, here is your gown if you would like to change. Okay, so I'll just put it in here. So just tell me if you would like to put the gown on. Okay, now we are actually good to go to start with the working phase, which is the first thing to do is to actually position the client to a supine position. Okay, Bert, you can lie down in bed now. Okay. Okay, and to cover her upper part and the lower part of her body with a bed sheet. Okay. Okay, since I have a adult male client, so I'm just going to ask him if he would like to also include covering his upper part or his chest part. Okay, Bert, is it okay to leave your upper part of your chest, to not cover your upper part of your chest? Is it okay?
It's okay.
Okay, thank you very much. Because actually, if we have a female client, then we would actually need or make sure to cover her upper part of her body or her chest area also. Okay, as you can see, leaving the abdomen exposed. Okay, and we are actually had our client in a supine position, because actually this position allows any air in the abdominal region to rise into the surface area. And of course, the proper positioning facilitates comfort and the efficiency in performing the assessment. Okay, so now that I have positioned my patient, okay, and now that her abdomen is exposed, I am now actually good to start the assessment by starting looking, so inspection. Okay, so the first thing that I'm going to inspect or to observe is for the abdominal skin. Okay, so the things that I'm looking for here on the skin on his abdomen is first for any vascularity. So if my client has visible dilated veins or spider veins in her abdomen. Okay, so great. I'm going to put that. Okay. So by looking at his abdomen, I don't see any visible veins, any visible dilated veins or spider veins. So I think we're good here. So the next thing that I'm going to inspect or look for in the skin is for any striae. Okay. Actually, I'm looking for here if my client has a purple striae, because that could actually indicate a Cushing's disease. Okay, so I don't see any purple striae actually here. Okay, so I think we're good to go. And I don't see any scars, lesions, or rashes because that is the next thing that I'm going to inspect here. So I don't see any of those here. Because actually, if the client has scars, then we have to actually note for the history, so the cause of that, and we're going to note for the location of the scars by quadrant because in inspection, we're actually going to check all of the 4 quadrants. Okay, so next thing that we're going to inspect for his abdomen is for the umbilicus, for its color, contour, and the location. Okay, so I have here the located now his umbilicus. Okay, and for the color, I'm actually looking for here if my client has any discoloration here in his umbilicus or around his umbilicus. Okay, so I'm actually just looking if he has any bruising in his umbilicus area. So bruising, that would be a discoloration of a purple, a bluish, or a yellowish. So a bruise, but I don't see one because that actually indicates a colon sign, which is a hemorrhage or a bruising here. So I don't see any bruising around my client's umbilicus, so I think we're good here. Okay, and now the next thing that I'm going to inspect is for the contour. Okay, so normally or typically, the contour should be rounded or flat and not distended. Okay, because if the client actually have a concave or an inward curve, or if her abdomen sink, or if he has a sink abdomen, that or it actually may be associated with dehydration and the malnutrition. Okay, so by looking now, okay, I see that my patient's abdomen is rounded. Okay, what I'm actually expecting to see, that my patient's abdomen is rounded or flat, and in my patient's case, it's rounded, so I think we're good here. Okay, and now, the next thing that I'm going to inspect is for the abdominal girth. Okay, so in looking or inspecting for that, I'm going to inspect the area in between the lower ribs and the pubic bone, and I'm going to note for any abdominal enlargement. Okay, so now we're just looking on this area in between the pubic bone and the lower ribs. Okay, I don't see any abnormal enlargements. Okay, so I think we're good here. Okay, so now I'm going to proceed to the next step, which is to measure for it, to measure the abdominal girth, of course, by using a measuring tape for this. And we're actually in doing this and measuring the abdominal girth, we're going to actually do this at the same time of the day. So now, but ideally, in performing this would be in morning. Okay, so I'm going to get for the measuring tape. Okay, so now in measuring for this, the first thing that to do is actually to ensure that the client has emptied his bladder. I know that I have already covered and confirmed that earlier, but for the completeness and to properly show you the procedure of this measuring the abdominal girth, so I'm going to demonstrate it. Okay, Bert, have you already peed or void this morning or before I came in here?
Yes, I have.
Okay, that's great to hear. And now I'm going to have the client to stand or still in the supine position. But today I'm going to have my client to stand so that you can properly see or for the better viewing of the demonstration. Okay, Bert, can you actually stand for me? Okay, here. Okay, I have now the tape measure. If a tape measure is not available, we can actually use a strip of cloth or a gauze, and we can just measure that with a cloth tape measure or a yardstick. Okay, now in measuring the abdominal girth, so I'm going to take the measuring tape and place it here behind the client like this, because we're going to wrap it around his abdomen, and we're going to make sure that it's in the level of his belly button or in his umbilicus. Okay, it's in the level of his umbilicus. I'm going to take that here, and the zero, getting the zero, and the other side also into the 0. Okay. So now I'm going to record the findings, which is, this is actually a 33 inches and 5 quarters. Okay, so I'm going to record for that. Okay. Now that I have recorded the findings, so next is now I'm going to take full future measurements at the same location. Okay, doing that again, the same location for future measurements. Okay, and what I would like to do now is I'm going to use a ballpoint pen. I'm going to mark the site right now. Okay, we're actually doing this because this ensures that future measurements are accurate and at the same measurement. Okay, so now I'm just going to ask the client to not wash the mark until it is no longer needed. Okay, Bird, you can now lay back. Okay, Bird, just don't wash the mark on your skin of your abdomen yet, okay?
Okay.
Okay. Okay, next thing that I'm going to inspect is for the symmetry. So I'm actually going to ask the client here to raise his head to further assess for herniation or diastasis. So bulge, I'm going to look for that. And I'm also going to inspect the abdominal movement when he breathes. And afterwards, I'm going also to observe for his peristalsis or for the peristaltic waves. Okay, now I'm actually good to go to the next part of the assessment, which to auscultates or auscultation. So it is very important to first listen, okay, before we actually push or press around our abdominal cavity, because that could certainly fire down our bowels. Because the first thing that I'm going to listen or auscultate for his abdomen is for his bowel sounds. Okay, so by auscultating for that, of course, I'm going to use the diaphragm of my stethoscope, and I have to make sure, or we have to take note here before we place or before the placement of the stethoscope or the diaphragm in the skin or in his abdomen, we have to make sure that it is warm, okay, and not cold. If it's cold, that could actually get the patient to be uncomfortable. Or stethoscope over his abdomen, we have to make sure that we apply it with light pressure or just by simply resting the stethoscope over his abdomen, especially if his abdomen is tender or in pain. Okay, and in auscultating, of course, we're going to auscultate all the 4 quadrants. Okay, so starting at her right lower quadrant, then to her right upper quadrant, to the left lower quadrant, and down to the left lower quadrant. Okay, and in listening for that, we're going to actually listen for each quadrant for 5 minutes. So that would be a 1 minute minimum per quadrant to assess for any absence of bowel sounds. Okay, and also for listening, we're going to actually, or I'm actually going to also note for the pitch, the intensity, and the frequency of the bowel sounds. And I might hear here in his abdomen, okay, we might hear the borborygamy, which is actually the stomach growling sound, which would be characteristic of someone who is hungry. Okay, so that would actually be a normal findings here. Okay, right now I'm going to listen for your abdomen. Okay, so you're going to actually feel little pressure here. Okay.
Okay.
Okay, starting here in your right lower quadrant. Okay. Okay, so I think we're good here. So the next thing that I'm going to auscultate is actually for the vascular sounds. So here I'm going to use the bell part of the stethoscope to listen for bruits here in the great vessels of the abdomen. So it's important to remember that the aorta, okay, which is in here, that going to come down here from the epigastrium to the umbilicus and bifurcates to the 2 common iliac vessels here that goes to the external and to the internal iliacs and to the femoral arteries. Okay, so in listening for this, it's actually useful to just listen quietly right over the aorta. Okay, and and the bruit down here in the iliacs. And the also here in the renal arteries. Okay. Okay. Now the next thing that I'm going to listen is for the venous sound. Okay, using the bell part of the stethoscope and listening for this, the venous sound. So I'm going to place this in the epigastric area. So here in the upper part of the abdomen. This area. Okay, in their umbilical areas. Okay, now the next thing that I'm going to auscultate is for the friction rub over the liver and the spleen. So in listening for the friction rub, which is actually the grating or the creaking sound, okay, we're going to actually use and place the diaphragm of the stethoscope over the right lower rib cage and the left lower rib cage, and we're going to listen for the friction rub. Because here in our left side, just below the rib cage is actually our spleen, and anatomically located at posterior mid-axillary, about 6 to 8 intercostal spaces. And on our right side is actually our liver, and it is actually located anatomically about at the 6 to the 12 intercostal spaces here. I'm good to go to the next part of the assessment, which is the percussion. Okay, so the first thing that I'm going to percuss in my client's abdomen is for the tone. So actually what I am expecting here is to have some areas of tympany. So tympany, this is the drum-like sound with a single pitch, and also for areas of dullness. As the name suggests, it produces a dull sound because actually the dullness, this is the short, flat sound. Of course, yes, areas of dullness here in the abdomen, because actually if a person or if a patient's eating, then there's going to be a stool here somewhere in the intestines, and those locations actually produce that dullness sound. And also elsewhere here, we'll have pockets of air-filled intestines, which is actually normal, and that is called the scattered tympany. And if my patient's entire abdomen is distended and he has a diffuse tympany, which is actually abnormal, then that's when we're going to start to worry about something, because that could indicate a small bowel obstruction. Now I'm going to apply pressure on your abdomen. Okay, so you're going to actually feel a light pressure while I'm doing this. Okay, okay, so I'm just going to move it practically to cover all the regions in the abdomen, or to cover all of the 4 quadrants. Okay, Bert, now I'm going to apply pressure on your abdomen. Okay.
Okay.
Okay. The thing that I'm going to percuss now is for the span and the height of the liver. So by percussing that, by of course determining the lower border of the liver and the upper border of the liver. Okay, so the first thing that I'm going to percuss to determine is for the lower border of the liver. And as I've said, and I know that we all know about this, that our liver is actually in the right portion of our body. So for percussing for the lower border, I'm actually going to start here at the right lower quadrant, and then I'm going to work upwards, because this is actually the transition that I'm going to expect here, is the transition from tympany to dullness. So when I percuss and reach the area that produced the dullness sound, so I'm going to mark that, because that actually just means that we have reached the liver. So that is actually the lower border of the liver. Okay, so Bert, now I'm going to apply again a light pressure on your in this part of your abdomen. Okay.
Okay.
Okay. Okay, starting now. Okay, now that I have percussed and marked for the lower border of his liver, so this is actually the liver border of dullness. So now that I have located for that, so now I'm good to go to assess the descent of liver, because that is actually the first thing to do to locate the liver border of dullness. Okay, Bert, now I'm going to apply pressure, okay?
Okay.
Okay, take a deep breath in for me and hold it, okay? Okay, now exhale, breath out. Okay. Thank you very much. And now that I have done that, so the next thing that I'm going to percuss now is the upper border of the liver. I'm going to locate the upper chest, the right upper chest of the patient. So here in the right upper quadrant, then I'm going to work downwards. So of course, here is the transition of the lung resonance to dullness. Then I'm going to mark the area of the dullness. Okay, Bert, now I'm going to apply again a pressure on this part, okay?
Okay.
Okay, starting here. Okay, I have the dullness, this area. Okay, now I'm going to measure the distance between the two markings. Okay, so in centimeters, it's actually 6 centimeters. Okay, so you can see here. Okay. Okay, so next thing I'm going to do now is I'm actually going to repeat the percussion of the liver, but in this time, or by this time, in the mid-sternal line of the patient. Okay, Bert, now I'm going to apply a light pressure again. Okay?
Okay.
Okay. Okay. So next thing that I'm going to percuss now is for the spleen, specifically the location of the spleen. Okay, as we all know, the spleen is actually in our left portion of our body. So here, I'm going to begin actually percussing in her posterior left mid-axillary line, and then I'm going to just work downwards till I am going to reach the area of dullness. Okay, Bert, can you raise your left arm now? Okay, I'm going to assist that. Thank you very much. I'm going to position myself here. Okay, Bert, now I'm going to apply pressure on this portion of your body. Okay?
Okay.
Okay, starting now. Okay, resonance, 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 dullness. So this is actually the location of your spleen. Okay, Bert, you can now lower your arm back. Okay, thank you very much. Okay, so next thing I'm going to do now is the second method of percussion here in the spleen. This is actually called the Costello's method. This is actually done because this is used to actually to give us a hint if the spleen is enlarged. Okay, so by doing that, we're going to actually follow the anterior axillary line here, and we're going to find the last intercostal space that we're going to feel. And here we're going to percuss, because normally, like this, it produces a tympanic sound. So I'm going to ask the client to exhale, and if the sound from tympany changes to dullness, that actually suggests that the client might have a enlarged spleen. Okay, Bert, now I'm going to start.
Okay.
Here. And the Bert, now I'm going to apply pressure here, okay?
Okay.
Okay. Okay, tympany. Okay, Bert, take a deep breath in for me. Okay, breath out. Okay. So the next thing now that I'm going to do is the blunt percussion, or a fist percussion. First here on the client's liver. Okay, Bert, can you actually sit for me? Okay, on that side, please. Can you actually move in this side of the bed, facing in this side? Okay. Okay, thank you very much. So now in the blunt percussion of the liver, so as we all know, it's on the right portion of our body. So here I'm going to make a fist of my non-dominant hand, and I'm going to, or my left hand, and I'm going to place it on the anterior, okay, right rib cage, anterior rib cage of my patient. Then I'm going to take my dominant hand, or my right hand, or I'm going to make a fist also, and I'm going to actually thump or strike it with the ulnar surface of my dominant hand. Okay, Bert, now I'm going to apply pressure here, okay?
Okay.
Okay, 1, 2. Going to start now. Okay, so now the next thing I'm going to do is the blunt percussion, or still the fist percussion, but by this time it's going to be on the kidneys. Okay, so Bert, can I actually ask you to go on that side? Okay, move forward here. Okay, thank you very much. Okay, so here in the percussion of the kidneys, or the blunt percussion of the kidneys, so I'm going to actually place my hand, or my left hand, okay, on the costovertebral angle. So here, and I'm going to take my dominant hand, Okay, I'm going to make a fist, and with the ulnar surface, I'm going to actually make a firm thumb. Okay. Okay, so Bert, I'm going to apply pressure. Okay, tell me if it's painful. Okay, 1, 2, 3. Okay. So I'm going to proceed now to his right kidney. Okay, so Bert, I'm going to apply pressure now.
Okay.
Actually doing this is this actually in order for us to know if kidney disorders, if my patient has any. So we are doing the blunt percussion of the kidneys. Okay. Bert, you can now lie down back again in the bed. Okay. Okay, now of course covering the lower part and the upper part of the client's body with the bed sheet. Okay, so since I have an adult male client, I'm just going to ask him if he would also prefer to include covering his upper part or his chest area. Okay, Bert, do you want me to drape your chest area, or is it okay to you to leave it undraped? Is it okay with you?
Okay.
Okay, thank you very much. Now that the abdomen is exposed, and now as you can see that the client is in a supine position again, we are actually now good to go to the next part of the assessment, which is palpation. Okay, so Bert, I want to ask you to actually tell me now and point out to me the area or which part of your abdomen in your belly area is painful when touched. Is there any area of your abdomen?
None.
Okay, there's none. Okay, that's great to hear, because I'm actually asking for that if my patient has a tender or painful area around or in his abdomen, because actually starting the palpation, we should start at a non-tender abdominal quadrant. Okay, so of course starting the palpation using the palmar surface of our fingertips. So here now I'm going to compress, okay, now at a depth of 1 centimeter. Okay, so Bert, now I'm going to feel your tummy, okay? So tell me if I am doing something that is uncomfortable with you, okay? Start now. Okay. 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 I think we're good here. So the next thing that I'm going to do is I'm actually going to do the palpation again, but this time I'm going to palpate deeply to delineate organs. So since I'm going to deeply palpate, so I'm actually going to compress now at a maximum depth of 5 to 6 centimeters. And here I am going to note if there's any resistance and a deeper structures that I'm going to feel here. Because actually if I'm going to feel any resistance when I press down or palpate it deeply, or any deeper structures, then I'm actually going to perform afterwards a bimanual palpation. Okay, Bert, now I am going to feel your tummy again, but by this time I'm going to press harder, okay?
Okay.
Okay. Mhm. Mhm. Okay. So as I palpate deeply, I don't feel any resistance at all, and I also don't feel any deeper structures. So I think we're good here. So the next thing that I'm going to palpate now is I'm going to palpate for masses. Okay, Bert, now I'm going to again apply pressure on your belly, okay?
Okay.
So tell me if it is painful. Okay. Okay. Mhm. Okay, I don't feel any masses at all, because actually if we felt any masses, actually have to note for the size of it in centimeters, the location, the shape, the consistency, the demarcation, the pulsatility, the tenderness, and the mobility of it. The next thing that I'm going to palpate, which is the patient's umbilicus and the surrounding of the umbilicus. Okay, so I'm going to palpate here actually for the swelling, bulges, and masses. Okay, Bert, now I'm going to palpate the area of your belly button. Okay, so
Okay.
tell me if it is painful. Painful, okay?
Okay.
Okay. Mhm. Okay. There's no swelling, no bulges, and I don't feel any masses, so I think we're good here. Now, or the next thing that I'm going to palpate is for the aorta. So in palpating for the aorta, we can actually either use our thumb with the first finger or we can use both of our hands. Okay, Bert, now I'm going to, again, going to apply pressure, okay, on your
Okay.
belly. So tell me if it is painful, okay?
Okay.
Okay. Okay, in palpating for the aorta, we are actually going to assess or feel for the pulse or the pulsation. Okay, I feel now his pulse here, and it's actually in irregular rhythm. Okay, so that's great. Okay, now or the next thing that I'm going to palpate is for his liver. Okay, as we all know, our liver is on the right side of our body. So the first thing that I'm going to do now is I'm going to position myself. So I'm going to stand at the right side of my patient. Okay, now I'm on the right side of my patient. Okay, so in palpating the liver, actually we are going to use both of our hands because we're going to actually place our non-dominant hand, so our left hand here, okay, at the back of our patient at the 11th and 12th rib posteriorly. And we're going to lay our right hand, okay, here parallel to the right costal margin. Okay, so parallel to the costal margin, and our fingertips should actually pointing towards the client's head, as you can see, so like this. Breath in for me. Okay, breath out. Okay. Thank you very much. We're going to actually note for the consistency and tenderness. Okay, Britt, do you actually feel pain when I press it forward?
No.
How about when I press it downward? Okay, thank you very much. Okay, now still palpating actually for the liver, but by this time is by hooking. So here, we are actually going to stand. Okay, so I'm going to move here. We're going to stand at the right of the client's chest and facing our body at the client's foot. And now we're going to curl our fingers like this, just making a hook, so as the method's name suggests, so just by hooking. Okay, so I'm just going to actually hook here at the edge of the right costal margin. Okay, Bert, take a deep breath in for me and hold it, please. Okay, and now exhale. Okay, thank you very much. And we're also going to note here for the consistency and tenderness. Okay, Bert, do you actually feel pain when I have pressed it inward? No.
No.
How about when I pressed it outward?
No.
Now, the next thing that I'm going to palpate is for the spleen. As we all know, it's on the left side portion of our body. Okay, this is actually a two-way method. Okay, Bert, now I'm going to actually apply pressure, okay, on this left side of your tummy, okay?
Okay.
Just tell me if you feel any pain when I'm actually pressing it. Okay. Breath in for me, Bert. Okay, now breath out. Breath in. Okay, now breath out. Okay. So the second method is I'm actually going to ask my client to roll on the right side or on his right side, because this is actually the this second palpation of the spleen. This is actually used when we suspect that the spleen is enlarged. Okay, Bert, now can you actually roll or face on your right side or towards me? Okay, thank you very much. Okay, going to put my hand here posteriorly to support. Okay, Bert, going to palpate now. Okay, I'm going to press this portion of your body, your left tummy. Okay, the area of your tummy. Okay, breath in. Breath out. Okay, thank you very much. Okay, now properly lay back again, your back. Next thing that I'm going to palpate now is for the kidneys. So since I'm on the right side of my patient now, so I'm going to first palpate for the right kidney. So in palpating for the right kidney, I'm going to actually place my left hand posteriorly on the flank. So in the posterior flank, like this. This is actually for support. And then I'm going to place my right hand here, okay, at the mid-clavicular line, just below the coastal margin. Okay, I'm going to ask my patient now to exhale and hold it. Okay, breathe. Okay, now breath in for me, please. Breath in. And now exhale. Hold it. Okay, you can now breathe. Okay, thank you very much. I'm going to press or apply pressure here on the left side of your belly, okay?
Okay.
Okay. Now breath in for me. Breath in. And exhale. Will you exhale? Hold it. Okay, now you can breathe. Okay, thank you very much. That is actually the palpation for the kidney. But we can actually palpate the kidney here or compressing here at the symphysis pubis. But since this is just an online return demonstration, so I can't actually show you that procedure. But in palpating here for the kidney, here in the symphysis pubis, we're just going to actually compress that, okay, inward and in outward or downward motion. Okay, test for psoas signs. Okay, Bert, can you actually face your left side? Okay, or lie on your left side. Okay, thank you very much, Bert. I'm going to remove this bed sheet on your legs, okay?
Okay.
Okay. Okay, keeping your legs straight. So now I'm going to actually extend his leg, and when I'm doing that, I'm actually going to note for the pain and the reaction of my patient. Okay, Bert, I'm going to move your leg back, okay? Just let me know if you feel any pain. Okay, so do you feel pain when I'm doing that?
No.
No? Okay, that's good. Okay, now actually properly lie down. Okay. So now the next test is for the obturator sign. This is actually another sign of appendiceal irritation. This is actually the internal obturator muscle that lies close to the appendix. And if that muscle is stretched in the setting of an acute appendicitis, then the patient will actually experience increased right lower quadrant pain. Okay, Bert, now I'm going to get your right leg, I'm going to support his knee and his ankle. Okay, Bert, now I'm going to move your leg, okay? Just let me know if you feel any pain.
Okay.
I'm going to stretch it this way. Okay? Okay, you feel pain?
No.
Okay, that's good. That just means that when your muscle, your obturator muscle is stretched, you don't actually feel any pain. So that just means that you don't have any appendiceal irritation. So that's good. So the next test, or now, is for the appendicitis. So for the appendicitis, we're going to actually assess the rebound tenderness. Okay? So we're going to locate two landmarks, the navel and the ASIS here. Okay, this is actually to locate for the McBurney sign. Okay, so I'm just going to actually press here or place my finger to push actually here and mid portion of the navel and the ASIS. Okay, Bert, now I'm going to press here, okay?
Okay.
So just tell me if you feel pain when I pressed it and when I lift my hand, okay?
Okay.
So I'm going to press now. So do you feel pain when I pressed it?
No.
How about when I lift my hand away?
No.
Okay, that's good. Okay, because actually when the patient or if patients that has appendicitis, they are actually often report that they are actually experience pain or has a positive pain when I am going to do now. So I'm actually going to help my client put on his clothes. Okay, that's it. You can lie now back again in bed. Okay. So are you comfortable in your position now? Okay. First, what I want to do now is I'm going to tell you what I have acquired, okay, during the assessment. Okay?
Okay.
Okay, so Bert, when I actually inspect your abdomen, I don't see any swelling, so that's good, and I don't see any discoloration. And when I feel for your abdomen, I actually don't feel any bulges or masses, so that's good also. And I also palpated for your aorta. I can actually feel the pulsation there, so that is actually what I'm expecting to actually feel. Okay, and also for your psoas sign, for assessing your psoas sign, when I actually hyperextend your leg, you don't actually feel pain, and when I actually move or stretch for your obturator muscle, you don't actually feel pain when I stretch it, so that's good also. Okay, so Bert, do you have any clarifications or questions now? No?
No more.
Okay, thank you very much. So Bert, since we're done with the assessment, so I'm going to actually head out now and for you to have some rest. Okay?
Okay.
Thank you very much. Okay? Have a good day.